Hi there, my name is Gerard Green. I'm a specialist pelvic health physio in Birmingham in the UK, and we are here on Tuesday, the 20th of April, 2021. And summer, I think, has arrived in the UK, and much more positive with COVID, thankfully. And it gives me great pleasure to finally meet and speak to Emma Brockwell. So Emma is very well known in the physiotherapy world and the pregnancy postnatal pelvic health world. And Emma is a physiotherapist who's based down in Godstone, which my geography of that area is not very good. So to me, that is a long way south of London, but she can tell us where she's based exactly. And Emma does a few things. She's works clinically in her physiotherapy clinic, and she is a really strong advocate for mums and mums to be and women getting help for pelvic health conditions. She's a powerful advocate for that, and she is also very passionate about getting more physiotherapists and other professionals getting more awareness of pelvic health. And more recently, to my astonishment, because she seems to do a huge amount, is she's written a book. And the book is Why Did No One Tell Me? How to Protect, Heal and Nurture Your Body Through Motherhood. And I've read the book, as I said, 3 times, and it is really powerful. It's a really powerful book. So Emma, welcome, and tell us what you do.
Wow. First of all, thank you so much for having me. And I'm so embarrassed that this is really the first time that we've spoken, when you were someone that helped me on my journey to pelvic health when you started the Women's Health Physiotherapy Facebook group. So I can thank you in part for getting me interested in pelvic health, although I'd started my journey a little before that. But wow, I think you've said a lot. Most importantly, I'm a mum of 2, and I have a stepdaughter as well. And I'm a clinician, and I'm a huge advocate of pelvic health, disseminating information to women that I feel we should have. And I do that via my social media account, a podcast that I run with Gwyneth Donnelly called Actual Cervix. And I also have, as you say, written a book. And I work for a few various charities on their clinical advisory boards, just so that we can really, as we've all been trying to do now for so many years, really push the importance of pelvic health into other professions. Because let's face it, we are still a little bit, as Gwyneth Donnelly would say, the Chandler Bing of the physiotherapy world. So it's just helping people understand what we do. And by doing that, I hope empower women to at least get some treatment for a lot of very common but not normal pelvic floor dysfunctional conditions.
Brilliant, and thank you for giving us a good idea of all the things you do. Now, as we knew we were going to speak to you, we asked some of our mums and mums to be to throw some questions at you. So we've got quite a few. So here goes. So, is it important to exercise your pelvic floor during pregnancy also?
Yes, simple answer to that. Interestingly, I had a conversation with someone yesterday who asked if they should stop doing their pelvic floor exercises at the end of their pregnancy for fear of causing issues during childbirth if they were to deliver vaginally. And we've really come away from that now. We need to be thinking about strengthening and connecting with the pelvic floor, but also learning how to relax it. Yeah. And you're only going to learn how to do that by doing your pelvic floor exercises correctly, which if you're uncertain of, that's where we really come in to help you. So yes, 100% do your pelvic floor exercises. We think postnatally, it gives you so many advantages. And it's like any other muscle in your body. If you don't use it, you're not going to have as greater ability to use it.
And then linking to that, is there any benefit to doing tummy exercises or abdominal exercises during the pregnancy?
Yeah, I mean, there's so much conflicting information around all of this at the moment, because we don't really have true evidence to back ourselves at the moment. But what we can be sure of is that this muscle is going to lengthen, this abdominal wall is going to lengthen. And by offering it some strength, that's going to help you postnatally. We do know that if you excessively load your abdominal wall, and that you excessively, repetitively load it in a dysfunctional way, then that's not going to help. That might actually be a risk factor for diastasis postnatally. But I'm a huge advocate of maintaining strength globally throughout the body, but exercising the abdominal wall, I think it's really important, so long as you're watching for signs and symptoms that might not necessarily help it.
So a little bit of good exercise is good. Too much of bad exercise is bad.
You got it.
And then you talk in the book, you talk about pelvic girdle pain. So, one mum has asked, so any tips for sleeping better?
Oh, I don't know about you with pelvic girdle pain, but I think we're really changing our thoughts behind pelvic girdle pain. We think it's very, very biomechanical. Things were out of alignment. We know that's not the case anymore. We know there's a big biopsychosocial model. In fact, one of the biggest risk factors for pelvic girdle pain is stress, fear, anxiety, depression. So what we really need to tap into with women with pelvic girdle pain is, what are you nervous of? What perhaps is making you anxious? What's stressful? Pregnancy stressful, because it's when your body's at your
especially at the moment.
Massively stressful at the moment in this pandemic. So what I would encourage you to do is think about what you're doing during the day. Think about how you can wind down before you go to bed. That's mindfulness, some stretches, some movement. We know that new novel movements like dancing, qigong, yoga, really nice exercises just to switch the mind off. Think about what's in your bedroom. Is it something affecting your sleeping, like too hot, too cold? Phones are 100% the big thing. It's that blue light, too much going on. We need to switch off. So actually, although I'd encourage you to find some good sleeping positions with a nice pillow that supports your bump, don't think so much about that. Think about coming away and de-stressing. I think that's really important. I don't know if you'd agree, Gerard, but I do think...
Yeah, definitely. De-stressing, having that anxiety explained, and keeping active, and continuing to exercise, continuing to move.
Yeah,
and then, so you do lots on Instagram. You use Instagram in a very great way to promote how mums can find help and what mums can do. And I use Instagram, probably probably need to use it a bit more. I kind of feel I'm getting a bit too old for Instagram.
Rubbish.
On Instagram, so someone has said, on Instagram, we see people during the last trimester of pregnancy running with big bumps, and doing heavy weightlifting with big bumps. Does this relate to most women, or is it mainly athletes? I'm an occasional park runner and do the odd HIIT class. Is this applicable to me?
Oh, comparison is the thief of joy.
I like that, actually.
I think Instagram's brilliant and social media is brilliant, but there's a lot of smoke and mirrors when it comes to Instagram. And yes, absolutely, there are some women out there running crazy distances when they're, in their third trimester, lifting heavy weights. But what you need to think about is you, the individual. It really doesn't matter what that person's doing. What matters is what your body is happy to do. And if you find that doing just a part run in the once a week and some Pilates and some yoga is working for you, then amazing, spot on. What I wouldn't encourage you to do is go from doing very little exercise before you're pregnant to suddenly doing a huge amount because you see it on Instagram. Your body's not going to cope with that, because none of our bodies could cope with just jumping from nothing to all. So think of you, the individual. Don't compare. And yes, there are people doing that. It's not a lie, if you like, but is that something you were even doing pre-pregnancy? Ask yourself that. And actually, is it something you want to do? Do you want to be that?
And I suppose it's working out well. Before the pregnancy, what did you do?
Absolutely.
And what did you enjoy doing?
Yeah. Although what I would say is, if you want to explore different ways of exercising now that you're pregnant, I think pregnancy is a really nice time to explore exercise. If you're a runner, you might want to explore strengthening. If you weren't a runner, so long as you don't have any symptoms, low risk pregnancy, and you feel comfortable, you could explore a walk run program and see if running is for you. So, I think I always encourage you, though, if you're working towards a new sport, talk to a physio or your healthcare provider, just to make sure it's safe for you. But I think pregnancy is an exciting time to find different ways to exercise. So yeah, make the most of it.
And you've got lots about diastasis or tummy gaps, as a lot of people know it, in the book. And Gráinne has done a section. And Gráinne, who I know well, because I have been in Gráinne's kitchen, because she's the same part of Ireland for me. So is there anything I can do to reduce my chances of developing a diastasis or tummy gap? So is there anything that women can do during the pregnancy to lessen their chances?
Well, this may come as no surprise, but again, there's conflicting evidence around this. Again, we just don't have enough research to absolutely tell you yes or no about this. But what I would say is exercise, keep moving, do your pelvic floor exercises. Think about overexposing yourself to heavy lifting. If you have let's say you're a gardener, we do know that prolonged heavy lifting can potentially be a risk factor for postnatal diastasis. Be aware that diastasis is going to occur during your pregnancy. It has to, for that tissue to stretch a little and baby to grow. So it's not something that you should be fearful of. It's something that is going to happen. But again, getting connected to your body, not being fearful of movement and exploring movement, I think is one of the most important things. Will it stop you getting diastasis postnatally? I couldn't tell you for sure. The other risk factors for diastasis postnatally are genetics. If you have multiple pregnancy, if you're having a multiple pregnancy. So if you're fitting into those categories, then maybe it's worth thinking about really embracing that program. And I would look at having some physio during pregnancy as well. What do you think, Gerard?
Yeah, I would agree with you. I think that there isn't, when you start to look at the evidence, there aren't that many things that we can say, well, if you do this, you won't get it done. I think I'm a big believer, like you, that it's good for people to get checked by a specialist, pregnancy postnatal physio, during the pregnancy and afterwards.
Yeah, and that's a good point you raised, because I don't think we see enough women during their pregnancies to actually know what might benefit them postnatally. And so what will become interesting now, is women are much more on this. So,
I think we see the ones not crisis is too strong a word, but we see the ones who have got debilitating pelvic girdle pain, low back pain. So I think the people who come to see us are really, really struggling. Whereas I do feel that people would benefit from seeing us a bit like a bit of prehab, preparation.
Essential, I think.
And you're going to love the next question. So it's really confusing online, particularly on Instagram now. It's really confusing online with diastasis, both for patients and physios, especially the physios, maybe the musculoskeletal physio, sports physio. So, does the gap matter or not? And can I just exercise as I like? Because we will see women doing sit-ups and deadlifts several weeks after. But does it matter?
Yeah, you're right. There's been a big shift around that.
Things are getting more confusing.
I agree with you. I was having this conversation with Gráinne yesterday, actually. It seems more complicated now than it did when it felt complicated already a few years ago. I think what we're trying to encourage as clinicians is to come away from the fear. We have definitely instilled upon women fear: never sit up again, never do a plank again. And that's because we actually had belief that those sorts of exercises postnatally were going to make diastasis worse, or certainly not improve it. What we do know now is that this whole diastasis we have to have a biopsychosocial approach. So we need to be thinking about the woman as a whole, and offering women rehab. I wouldn't suggest doing a V-sit or a sit-up at 2 weeks postnatal is a very sensible option, no matter who you are, even if you have the smallest of gaps or the biggest of gaps. I would very much promote to you that if you think you have a gap and you've just had your baby, do not worry. Most women, for about the first 8 to 10 weeks, are likely to have a slight gap. But by that point, 8 to 10 weeks, natural healing should occur, and it does for 2/3 of women. For that final 1/3 of women, for reasons we don't fully understand, that doesn't happen. I was one of those women, and I'm a physio. I should know how to avoid it, right? But we don't. So I think the big thing for sure, Oh, have I lost you?
No, I'm still here. I'm still here.
Still here. I think the big thing for sure is if you have noticed some bulging or doming at the midline of your abdominal wall and you're about 6 to 8 weeks postnatal, see a pelvic health physiotherapist who perhaps likes diastasis, specializes in treating it, and then we can talk you through how to rehab for you, because it's going to vary for everyone. But it's not just about exercise, it's things like avoiding constipation. That's a big driver with this stuff.
And that is covered very, very well in the book as well. Yeah. And really, here in the UK, do you see many women who need to have surgery for a diastasis, or in the UK, is that uncommon? I know we see lots of patients in Birmingham, and very, 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 very few have surgery. But what are your thoughts on, say, the women that you see?
Same in the south, really, and I would say across the UK. I don't think it's a common consider doing surgery for at least 18 months to 2 years, until you've had a really good amount of rehab and you've exhausted all of your options. And I think it's much more prevalent in America, having surgery. And I would question whether it happens too soon for some women in America. So I think there's a lot to be gained from rehab, and a little bit like you said earlier, prehab. Even if it's something that you might end up having to have, the stronger you are pre-op, the better your outcomes are going to be post-operatively. So I would always have, if you feel you might be a surgical candidate, have it very far back in your mind, because I would definitely promote doing a good year to 18 months worth of rehab before you even start going down that road.
And probably fitting in with the surgical question, someone has said, I have a prolapse, a mild prolapse. Will I need surgery or not?
I hope not, no. If we look at the NICE guidelines, you should be having at least 6 months worth of physio before you even start exploring that option. And someone with a mild prolapse, if treated effectively, no, you shouldn't need to have surgery at all. These are really worst case scenarios, and we need time for your body to heal. You've got to remember, along with the abdominal wall, your pelvic floor takes around about 7 to 9 months just to heal and strengthen. And so you need to give yourself time. Bounce back is a myth. And therefore, you need time to rehab, time to strengthen. And hopefully, a year postnatally, you'll find that your symptoms are all but improved, and that you can then get back to the exercise that you love as well. So surgery, no, should always be a final option.
Yeah, and these are really positive words to hear from you. The next question is then, so one of the mums has said, and this is something we see a lot in clinic with particularly Alina. So no one told me about vaginal wind. What can I do about this? Because it's really awful.
Yeah, it can be really horribly embarrassing for women. I would use that as a sign and symptom to, if you can't afford private healthcare, see your GP and be referred to a pelvic health physiotherapist. Start your pelvic floor exercises. It's simply a way of your system's not quite managing the pressure that you're generating, perhaps because it's not strong enough, or perhaps we need to see if you have any signs of prolapse. It's not something you should have to put up with, and it is something with time and with compliance of exercise that you should be able to improve on for certain. But yes, it is something that we should be making you aware of, I think, so that then it normalizes it, and then you can get some treatment for it.
And then a really interesting comment from someone is that, and I've done really well post-pregnancy and I feel good, but I feel a bit guilty about this. And sometimes when I meet my friends, even in the limited way I can meet them now, I feel I should make something up almost, because I should almost say that I am struggling.
No. Why feel guilty? I think we need to get rid of mum guilt massively. We feel too guilty about every single element of our new lives as being a mum, and I think that's because society doesn't offer enough nurture to mums. It's all about baby, and the emphasis goes away from mum. I would say a happy, fit, healthy mum leads to a happy, fit, healthy family. And we are I really believe we're the cornerstone of the family unit. So if you're happy and you're feeling good and you've gone out and exercised, first of all, that's hugely motivational to your friends, and second of all, it's hugely motivational to your family and your kids. So ditch the mum guilt. It's not necessary. So long as you're happy, that's the most important thing. And really, doesn't matter what other people think. I don't think it does. So long as
Brilliant.
you're happy.
And I've had a C-section, someone has said. Is it safe to massage my scar as it's quite sensitive?
Yeah, I'd say it's really important to massage your scar. So long as it's healed, so long as there's no signs of scabbing or infection, get that tissue desensitized. It's sensitive possibly because it's not having enough touch. You've just been through major abdominal surgery, so by touching, moving the fascia, as we like to phrase it, is a really positive thing to do, and I would say an essential part of your C-section rehab. So yes, once you are infection free and scab free, get that tissue moving, and if in doubt or uncertain of how to do that, again, you can see a physio for that.
And then we're coming near the end. You'll be pleased to hear. And Emma, thanks. These are rapid fire.
I'm feeling the pressure.
Is a little bit of leaking okay when I run?
No, I wouldn't say it's okay. It's not ideal. I'd love it if you return to running once you've dealt with that symptom. Think of leaking like you've got a sprained ankle. And if you had pain when you ran on that sprained ankle, you wouldn't run on it. That said, if you return to running and you're leak free, but then you start experiencing a little bit of leaking, it might be that we can pull you back a little bit so that we can keep a little bit of running in, but we want you to run leak free in the parameters that your body's ready to. You've hit the sweet spot, your body's not quite ready yet for what you're doing, so let's just pull you back and rehab you and get you a bit stronger first. But it's not a reason that eventually, as to why you eventually can't run. So hopefully we can get you running once you've got a little bit stronger.
And Couch to 5 is really, it's a good graduated program.
Yeah, I think that's the best way to return to run is something like the Couch to 5 program.
And then I think I know what you're going to say to this, but it's someone has asked, last question, or the clinical questions. Sex is more uncomfortable and painful afterwards. Is that normal and okay?
No. Very common. About 1 in 10 women do suffer from that, but it's not normal. Sex is an essential function of most relationships, and we want you to feel comfortable and enjoy it again. The reasons you might be feeling uncomfortable could be related to hormone, particularly if you're breastfeeding. You might need some lubricant. Tissues might just need a little bit more help because the breastfeeding or the depletion of estrogen is not helping that tissue and making it feel a bit dry. Or it could be that your pelvic floor needs a little bit of rehabilitation. So again, speak to your GP, and just even if they're uncertain of it or passing various comments that, oh, well, you've had a baby, what do you expect? Just say, okay, but I'd like to see a pelvic health physio, please, because I know that this is something that can be treated.
And then, so you're a very busy person. So you have a family and you have a business and you've written a book and you do lots of advocacy work and you do a lot. So what do you do to relax?
I need to relax more. I need to do what more people should do, and that's just rest a little bit more. But I do love running and exercise. That's just my thing. You know, I run with a group of girls. I like a good gossip as well. I love going out, but there's nowhere to go at the moment.
Very true.
Pardon, Waitrose, did you say?
No. I said that's very true.
Yeah, I'm sorry, very true.
And
yeah.
Waitrose.
Do you know what? I was about to say, I do like popping to Waitrose because that's about the only shop that's open where I live. And Sainsbury's, of course, and all other good supermarkets. But I like going out with my friends and just doing what any other person likes doing, being around other people and connecting, which sadly, none of us have been able to do. So I'm welcoming this lift, hopefully, please God, of this lockdown.
And what's next for you, Emma? What's next for you?
So I am keen to develop more in my clinic and expand that. Unfortunately, my clinic closed down during COVID, so I had to look for another space. So I've got some plans in developing that. Hopefully a course with Grania and Helen McElroy, and I've got a few little courses that I'm doing for BICAP as well. So quite a few little fingers in the pies at the moment. But I would like a little bit of a holiday as well, because I haven't had a holiday for quite some time now. So a little bit of rest, a little bit more family time, really important. I haven't quite got that right balance at the moment.
And that's difficult. Emma,
Very.
a massive thank you. A massive thank you. The reason I just kind of come out of my screen, that was just the internet was a bit unstable at times. So just many thanks. And I think what I said, I think when I saw you'd done the book, I think I messaged you straight away and I said, I'm astonished you've done this, because I kind of thought, with everything else you do, I thought, how have you done this? And it's just an amazing achievement, and it will help loads of people like me as a physiotherapist, but it will also help loads of mums and mums to be and partners of those mums. And you know, a lot of people will be helped by your book. So a massive thank you.
Well, thank you, and thank you for all you do.
You up in real life.
Oh, me too. Can't wait. Thank you, Gerard.